Massachusetts free CNA practice test with answers 180 questions exam prep. Question 1. A resident wishes to be seen by a different doctor. What is your response? Option A. Help the resident contact the social worker or registered nurse for assistance. Option B. Reassure the resident that his current doctor is qualified. Option C. Tell him he cannot change without a legal procedure. Option D. Acknowledge the concerns and suggest a different provider. The correct answer is option A. Help the resident contact the social worker or registered nurse for assistance. Residents have the right to choose their physician and staff should facilitate this request. Question 2. Which of these correctly describes a resident's telephone rights? Option A. Residents may use phones but must provide their own. Option B. Residents have the right to use phones only during scheduled times. Option C. Telephones can be used only under a caregiver's supervision. Option D. Privacy and phone access are provided to each resident. The correct answer is option D. Privacy and phone access are provided to each resident. Facilities must ensure residents have access to private telephone communication. Question 3. When a resident refuses a bath, what is your responsibility? Option A. Respect the resident's wishes. Option B. Tell the resident they cannot have visitors. Option C. Call the family to persuade them. Option D. Give the resident a bath anyway but make it shorter. The correct answer is option A. Respect the resident's wishes. Residents have the right to refuse any part of their care including hygiene. Question 4. Which bathing consideration is frequently forgotten by caregivers? Option A. The use of proper body mechanics. Option B. Ensuring the water is at a safe temperature. Option C. Rinsing and drying the resident thoroughly. Option D. Beliefs about bathing frequency differs among cultures. The correct answer is option D. Beliefs about bathing frequency differs among cultures. Cultural preferences regarding hygiene should be respected in the care plan. Question 5. What is a proper precaution for a resident who is unable to move themselves? Option A. The resident should be turned once per shift. Option B. The resident should be routinely checked for pressure sores. Option C. The resident should be turned every 6 hours. Option D. Alignment is not important. The correct answer is option B. The resident should be routinely checked for pressure sores. Frequent skin checks and repositioning at least every 2 hours are standard for immobile residents. Question 6. Behaviors that may signal pain in the elderly include all of these except which one? Option A. Insomnia. Option B. Not participating in social activities. Option C. Not eating or drinking. Option D. Excessive talking. The correct answer is option D. Excessive talking. Pain in the elderly often presents as withdrawal or changes in routine rather than talkativeness. Question 7. What is an important, but frequently forgotten, consideration when providing hair care? Option A. The age of the resident. Option B. The length of the resident's stay. Option C. The race and culture of the resident. Option D. The environmental conditions of the room. The correct answer is option C. The race and culture of the resident. Hair textures and cultural styles require specific knowledge and appropriate products. Question 8. A resident is late to therapy because she is slow at feeding herself. What is the best action? Option A. Bring the resident to breakfast earlier. Option B. Withhold breakfast until after therapy. Option C. Begin feeding the resident yourself. Option D. Take her plate away when it is time for therapy. The correct answer is option A. Bring the resident to breakfast earlier. Adjusting the schedule allows the resident to remain independent while meeting their appointments. Question 9. Which of these may depend on facility rules when performing nail care? Option A. Reporting blue or pale nail beds to the nurse. Option B. The policy on cutting toenails. Option C. The position of the resident during care. Option D. Soaking the feet before starting. The correct answer is option B. The policy on cutting toenails. Many facilities restrict nursing assistants from cutting toenails, especially for diabetic residents. Question 10. When is the most appropriate time to use a soft toothette? Option A. When a resident is having a seizure. Option B. When giving an unconscious resident mouth care. Option C. When a resident is complaining of a toothache. Option D. When a resident has full dentures. The correct answer is option B. When giving an unconscious resident mouth care. Toothettes are used for gentle cleaning when a resident cannot use a standard toothbrush. Question 11. What is a Hoyer lift primarily used for? Option A. Moving a resident onto a stretcher. Option B. Helping to move a resident to a chair. Option C. Helping to move a resident into a vehicle. Option D. Helping to move a resident into a bathtub. The correct answer is option B. Helping to move a resident to a chair. A Hoyer lift is a mechanical device used to transfer non-weight-bearing residents safely. Question 12. Which of these is an incorrect procedure for shaving a resident? Option A. Using a towel to protect clothing. Option B. Checking for bleeding problems first. Option C. Shaving upward from the chin to the sideburns. Option D. Shaving upward on the neck. The correct answer is option C. Shaving upward from the chin to the sideburns. To prevent irritation, shaving should follow the direction of hair growth, which is typically downward on the face. Question 13. A resident with left side weakness needs help with a sweater. Assistance should be given where? Option A. On the resident's right side. Option B. In front of the resident. Option C. On the resident's left side. Option D. Behind the resident. The correct answer is option C. On the resident's left side. When dressing a resident with weakness, you should always dress the weak side first. Question 14. Which of these is not a common mealtime challenge for residents? Option A. Chewing or swallowing problems. Option B. Decreased recognition of hunger. Option C. Not being reminded when it is time to eat. Option D. Loss of ability to use eating utensils. The correct answer is option C. Not being reminded when it is time to eat. Nursing homes have scheduled mealtimes, so lack of reminders is rarely the primary issue. Question 15. Bad breath and skin breakdown in the mouth are symptoms of which of the following? Option A. General dehydration. Option B. A dry mucous membranes in the mouth. Option C. An overly moist mouth. Option D. Inadequate amounts of toothpaste. The correct answer is option B. Dry mucous membranes in the mouth. Dryness in the mouth allows bacteria to grow and tissues to become fragile. Question 16. A nursing assistant is feeding a quadriplegic resident. Which action is inappropriate? Option A. Offering small bites and allowing time to chew. Option B. Encouraging personable conversation. Option C. Sitting at eye level with the resident. Option D. Offering drinks only after all food is consumed. The correct answer is option D. Offering drinks only after all food is consumed. Fluids should be offered throughout the meal to assist with swallowing and hydration. Question 17. Why is morning care before breakfast important? Option A. It adds to a resident's sense of well-being. Option B. It helps to promote eating. Option C. It provides a pleasant appearance. Option D. All of these are correct. The correct answer is option D. All of these are correct. Hygiene before meals improves comfort and is a standard part of resident care. Question 18. Key considerations for bathing residents include safety, privacy, and which of these? Option A. Quiet surroundings. Option B. Dim lighting. Option C. A swiftness in the procedure. Option D. A providing security. The correct answer is option D. Providing security. Ensuring the resident feels physically and emotionally secure is vital during bathing. Question 19. Which of these is not a way to assist a resident to rest more comfortably? Option A. Create a quiet environment. Option B. Offer diversion activities like reading. Option C. Remove all positioning devices so they do not interfere. Option D. Pacing activities to allow for rest. The correct answer is option C. Remove all positioning devices so they do not interfere. Positioning devices are often necessary to keep a resident comfortable and in alignment during sleep. Question 20. Which of these statements is false for the care of a resident's dentures? Option A. Dentures are very slippery when wet. Option B. Dentures should be stored in cool water. Option C. The denture care is left to the resident. Option D. Dentures break easily and are expensive. The correct answer is option C. Denture care is left to the resident. Staff must assist with denture care if the resident is unable to do it themselves. Question 21. A small, watery leakage of stool could indicate which of these conditions? Option A. A gastrointestinal infection. Option B. A medication reaction. Option C. A fecal impaction. Option D. Pelvic muscle weakness. The correct answer is option C. A fecal impaction. Liquid stool can seep around a hard, impacted mass, appearing as diarrhea. Question 22. Which of the following is an inappropriate action when providing hygienic care? Option A. A thoroughly drying skin to prevent breakdown. Option B. To examine the skin for any injuries. Option C. Apply extra lotion between the fingers and toes. Option D. Encourage the resident to participate. The correct answer is option C. Apply extra lotion between the fingers and toes. Moisture trapped between fingers and toes can cause skin breakdown and infection. Question 23. It is time to bathe an Alzheimer's resident who has visitors. What is the best action? Option A. Ask the charge nurse to speak with the visitors. Option B. Ask the visitors to step out until the bath is complete. Option C. Perform the bath the next day instead. Option D. Ask the patient when you should come back. The correct answer is option B. Ask the visitors to step out until the bath is complete. Bathing is a private activity and visitors should be asked to leave to maintain dignity. Question 24. An electric shaver begins to spark and smoke. What should you do first? Option A. Call the nurse in charge. Option B. Finish the shave quickly. Option C. Use the roommate's shaver instead. Option D. Unplug the shaver. The correct answer is option D. Unplug the shaver. The immediate priority is to remove the power source to prevent fire or injury. Question 25. A client is paralyzed on the right side. Where should the signaling device be placed? Option A. On the left side of the bed near the hand. Option B. On the right side of the bed near the hand. Option C. Under the pillow. Option D. At the foot of the bed. The correct answer is option A. On the left side of the bed near the hand. The call light must be placed where the resident can reach it with their functional limb. Question 26. To lift an object using good body mechanics, the nursing assistant should do what? Option A. Keep both feet close together. Option B. Lift with the abdominal muscles. Option C. Bend the knees and keep the back straight. Option D. Hold the object away from the body. The correct answer is option C. Bend the knees and keep the back straight. Bending at the knees shifts the work to the legs and protects the back. Question 27. The care plan says to use a mechanical lift, but the client is very agitated. What should you do? Option A. Lift the client without the device. Option B. Force the client into the lift. Option C. Get assistance to move the client. Option D. Keep wheels unlocked during the lift. The correct answer is option C. Get assistance to move the client. Safety for both staff and the resident requires extra help when a resident is non-compliant. Question 28. A client starts to choke and turn blue during dinner. What should the assistant do? Option A. Remove the food tray and find a nurse. Option B. Slap the client on the back. Option C. Call for help and perform the Heimlich maneuver. Option D. Give the client a drink of water. The correct answer is option C. Call for help and perform the Heimlich maneuver. Abdominal thrusts are the emergency response for a complete airway obstruction. Question 29. When giving evening care to a client with dentures, where should they be placed? Option A. In the bathroom on the sink. Option B. In a tissue on the bedside stand. Option C. Under the client's pillow. Option D. In a denture cup with the client's name. The correct answer is option D. In a denture cup with the client's name. Proper storage in a labeled cup prevents loss, breakage, or contamination. Question 30. What type of fire can be safely put out with water? Option A. Electrical fire. Option B. Grease fire. Option C. Paper fire. Option D. Chemical fire. The correct answer is option C. Paper fire. Water is only suitable for Class A fires involving common combustibles like paper or wood. Question 31. The nursing assistant is responsible for all of these fire prevention measures except which one? Option A. Taking cigarettes away from all clients and visitors. Option B. Being aware of the locations of extinguishers. Option C. Reporting damaged wiring or sockets. Option D. Participating in fire drills. The correct answer is option A. Taking cigarettes away from all clients and visitors. Staff enforce rules but generally do not confiscate personal property from visitors without specific cause. Question 32. What should you put on a client's feet before walking them to a chair? Option A. Socks or stockings only. Option B. Cloth-soled slippers. Option C. Rubber-soled slippers or shoes. Option D. Nothing. The correct answer is option C. Rubber-soled slippers or shoes. Non-skid footwear is essential to prevent falls during ambulation. Question 33. What is the most important reason for using soap and water to clean skin after elimination? Option A. To keep the client happy. Option B. To prevent soiling of bed linen. Option C. To remove feces and urine from the skin. Option D. To keep the linen costs down. The correct answer is option C. To remove feces and urine from the skin. Waste products are caustic and will cause rapid skin breakdown if not removed. Question 34. A nursing assistant should refuse to perform a task in which situation? Option A. The assistant has not been trained to do it. Option B. The client is difficult to deal with. Option C. The assistant can find someone else to do it. Option D. The assistant is at the end of their shift. The correct answer is option A. The assistant has not been trained to do it. Performing tasks without proper training is dangerous and against professional standards. Question 35. Before helping a client into a bath or shower, what should the assistant do first? Option A. Check the temperature of the water. Option B. Shampoo the client's hair. Option C. Soak the client's feet. Option D. Apply lotion or oil to the skin. The correct answer is option A. Check the temperature of the water. Testing water temperature prevents accidental burns. Question 36. When taking a client's radial pulse, where should the fingertips be placed? Option A. On the chest. Option B. On the wrist. Option C. On the neck. Option D. On the elbow. The correct answer is option B. On the wrist. The radial pulse is located on the thumb side of the inner wrist. Question 37. To whom does the certified nursing assistant report directly? Option A. The nurse supervisor. Option B. The physician. Option C. The staff development nurse. Option D. The administrator. The correct answer is option A. The nurse supervisor. The charge nurse or supervisor is the immediate superior in the nursing chain of command.